Idea then, when we are searching for someone to love us and to love, we ought to be looking for people who reflect his image. I wish I had a witness in here. Somebody that loves like God, forgives like God, gives like God, walks with me like God. I need to be looking for his image. And if that joker don't have his image, hey, see you later, bag, let me pick this. If you can endure the stones, if you can endure the thorns, if you can endure the dry places, if you can endure the places you lack, if you can endure the places you don't have it all together, sooner or later he's going to lead you into green pastures where it's plush, where it's prosperous, and where it's peaceful. grateful. I don't know about you, but I look forward to those moments and I enjoy those moments. Because here's the thing, you can't stay in green pastures all your life. And to forget how you got there in the first place. So every now and then you got to go in and come out of green. Hey, family, good evening, good evening, good evening. I hope you have had a great day. Welcome. I'm so excited to have all of you here. Please let me know if you can hear me. Let me know if you can hear me. I know this is our first time back in a month. We've taken off the month of July, and it's good to see everybody back with me. Can you hear me? Let me know if you can hear me. All right. Yes, thank you so much. Thank you so much. I am excited tonight because our first night back, we have our medical minute, and I'm excited about our conversation tonight. Do me a favor. I need you to like and I need you to share. I need you to tell everybody, grandpa, grandma, mama, daddy, cousin, brother, sister, and them, that we are on the air. Well, we're not on the radio, but we're streaming, we're live. Come on, tell everybody we are live, and we are excited about this evening. I need everyone to share it because tonight's conversation is not just something that affects women; it also affects men. And so I need you to do me a favor and let everybody know we are here. I'm excited about what God is doing in our church this month. As you know, we celebrate 3 years, and so we're looking forward to our birthday party coming up next month in September. And so get ready for that. We're going to have a blast just celebrating what God has done in the 3 years we've been in existence. I am also excited that God is doing what he's doing in your life. And I pray he's just been blessing you way above and beyond what you could ever imagine. So listen, without further ado, I want to go ahead and pray, and then I'm going to actually give you just a little bit about our speakers tonight, and then I'm going to turn it over to them. Father, thank you for doing what you do and being who you are. I pray, Father, that in some way, shape, form, or fashion, that we have been pleasing in your sight today, that we've had an opportunity to make you smile, because we are totally grateful for you just giving us life, giving us breath, and the ability to be able to do what we do. God, I pray that you have shown yourself to be true and faithful in our lives today, and we've recognized that. Now, as we've come together to learn, I pray for our speakers, our presenters. I pray, God, that you continue to bless them as they're taking time away from their families to come and share with us. I pray, God, that you would bless them tremendously and the work that they do. Thank you for Parkland and all who serve in Parkland and all who are seen by Parkland. I pray, God, that you would just continue to have your way in their life. Now, Lord, just allow us to be able to be whole, that knowing that we are not just spiritual beings, but we are also physical beings, that we need to take care of ourselves. And so with the information given tonight, help us to implement it, that we may be able to serve you for the rest of our lives. In Jesus' name, amen. All right, listen, tonight we have with us Gladys Poblete. I think I said it right. She'll correct me when she comes on. She's a family nurse practitioner, works in the lung diagnostic and lung oncology clinic at Parkland Hospital. She's been a nurse practitioner for 21 years. She is happily married and with three teenagers and a dog who keeps her life spicy. She's devoted Christian. Hey, we love that. And she is very dedicated to her job as she feels that working in oncology is her calling and God given gift. And we believe in Christians being in the marketplace. And so that is amazing. And her gift has been able to help many people during their battle of cancer. And then we have Natalie Reed, who is the program coordinator of Parkland's Global Cancer Program. I'm excited to have both of them here with us this evening. And listen, you ladies take over. I'm gonna sit back and I'm gonna learn along with everybody else. Welcome to Pivot Church.
Thank you so much. Good evening, everyone. I just want to thank Pastor Holiday for just an uplifting, encouraging prayer. I mean, that just hit home, and it kind of really eased a lot of my anxiety. But I just want to thank y'all for inviting Natalie and I so that we can share this information with y'all. And we're excited. So just we want to introduce y'all to our lung cancer screening program here at Parkland Hospital. And lung cancer screening has something, it's been on the forefront for the nation, I would say probably in the last like 2-3 years, because lung cancer, unfortunately, has been on the rise. Let me see, how can sorry, I am just figuring this. Oh, here we go. Okay. There we go. Yes. So unfortunately, it's been on the rise, not only in our Dallas County community, it's been on the rise in the nation. It's now the third leading cause of death. The leading cause of death, cancer deaths in the nation and in Dallas County, but it's our third most common cancer here at Parkland. Lung cancer, unfortunately, it doesn't discriminate. It hits 1 in every 16 women and 1 in every 17 men. And so with our lung cancer screening program here at Parkland, we want to get that information out to make people aware of the program that we have, because we want to encourage screening so that we can detect cancer early and be able to increase the survival rate. So nationwide, though the cases have been increasing, it's because of the increased awareness of screening, and it's been able to increase the survival rate as well. So the 5-year survival rate you see there, it's a number that people have been using, people who have been studying and doing all the statistics. And basically what that means, the survival rate for lung cancer, once detected, is about 23%, which means out of every 100 people, 23 of those people are the only ones who are going to make it to 5 years. We want to change that with increased screening. And again, it's just a number because every person's different, every case is different, and that's how we treat it here at Parkland. So what can be some barriers to lung cancer screening besides not having the knowledge or not knowing that there's a program available to you? Some patients don't want to know. They may have had an experience with a loved one or a friend who has gone through the battle of lung cancer, so therefore they don't want to know because they feel good. Or some patients do feel ashamed, or they have that guilt because they may have smoked in the past or are current smokers, and they're worried about judgment. And so with the help of Natalie and the team behind her, we really want to get the information out so that people know it's a judgment-free zone. We are here to help you, and we want to let people know that our doors are open and that our program is available to you. So what are some risk factors to look for? Everyone knows that cigarette smoking is one of the leading risk factors for lung cancer. But along with cigarette smoke, and we can go into more detail about that, it includes pipes, cigars, chewing tobacco, and what we think, as the information will come out, possibly even vaping. There are some environmental factors, especially in certain parts of Dallas County where we do have older buildings. A lot of my patients in our Dallas County community work in construction, exposure to asbestos, other chemicals, radiation, um, air pollution. So family history, it is somewhat of a risk factor as well, but unfortunately, we don't have a genetic test for lung cancer like they do for breast. But when a patient comes to me and they do have a pretty heavy family history of lung cancer, I will be more vigilant and be very aware of that history. We put on their genetics. Genetics in the sense is that we don't know enough about lung cancer. And sometimes our DNA, something can change in there, which will cause the kink in the system and cause these cancerous cells to be made. And so we are able to test for those changes as well once a patient is diagnosed. And age is a risk factor as well. The typical number age that they say lung cancer can affect are that between the ages of 50 and 80, but that isn't necessarily always a hard stop. I unfortunately do have those who are in their mid to early 40s, even as young as late 30s. So again, these are some of the things that we have considered along with smoking: the cigarettes, the cigars or cigarillos. I've had patients who tell me they smoke they call them the small cigars, blacks, those as well, chewing tobacco pipe, and vaping also. I believe, vaping, it's relatively new to the game, but now that it's creeping up between 5 to 8 years since it's come into the community, I believe that more studies are going to come out and we're going to actually know what it does. You hear the term popcorn lung, you hear a lot when vaping first came out, a lot in the 20-something-year-olds and even the teens, they got lung injury. They may not have lung cancer, but they do have lung injury. So we've decided to loop that in just to let people know, hey, be aware. We just recommend that you just don't smoke any of it. So in cigarette smoke, there are at least 69 known chemicals that can lead to cancer. It can change the DNA of our cells. The DNA is basically like the blueprint. And if something goes wrong, the blueprint, something goes wrong in the factory, and then our body starts making cells that cause harm, or they do nothing. But when I say nothing, they do nothing, but they grow at such a fast rate that they become a mass and they take up space where good working cells are supposed to. And then that's how they cause damage. Secondhand smoke has been linked with lung cancer also. And because of this finding, I think it was the late 90s or 2000s where they stopped smoking in airplanes, in restaurants. You had to smoke like 25 feet from the front door because they did realize that exposing a non-smoker to secondhand smoke does increase their risk for lung cancer as well. So what are some signs and symptoms to look out for? When do you go to your doctor? When do you push? So for example, the first one on there is a chest infection that doesn't go away. Say you or a loved one that came down with bronchitis or pneumonia. You go to an urgent care, your doctor, they give you around antibiotics. You feel a little better, but not all the way, and then it comes right back. Well, then your provider at that time might say, well, let me give you something stronger. So then you go back, you get a little better, but it just never goes away. At some point, hopefully I would I encourage providers and patients to push like, hey, this isn't going away. Something's going on. Let's get an x-ray or a CT scan. So that's one of the top 3 or 4 that really concerns me about lung cancer. Fatigue is on there, but many things can cause fatigue. When I say fatigue, it's like you had a sudden change in your energy. You're taking more naps in the afternoon when you normally don't. It's getting harder to wake up in the morning. I know it can be a very vague symptom, but I want to let patients know so that they can go to their provider and say, hey, I've noticed this, and they can at least start a workup and look for other causes of the fatigue. And among those causes should be cancer. Loss of appetite or losing weight when you're not trying to. This is one of my top 3 also. For example, you're like, my pants are looser and I'm not even trying to lose weight. Or a family member comments on how thin you're getting and you haven't changed your diet. Or all of a sudden you used to be able to, you know, eat this dish and you're no longer finishing it, not just one time, but it's progressively getting worse over time. Go to your provider and let them know. Shortness of breath or wheezing is a concern. Hoarseness, believe it or not, is also one. A new cough that doesn't go away. That's again in my top 3. You just have this cough that just keeps nagging, doesn't go away. Please let someone know. They say that different things can cause a cough, of course. Heartburn, allergies, a cold. But if it doesn't go away, no matter how long or how many things you've taken, please let your provider know, and that should trigger more workup. Coughing up blood is also up there within my top 3 to 4. Constant chest pain, bone pain, like in your hips, in your shoulders, back pain. And this is not as common, but it is something to be concerned about. Also is swelling of the neck and face. I talk really fast, so if anyone needs to slow me down, just let me know. Please let me know. Okay, so briefly, again, I talked about that factory, that kink in the system where they're making a bunch of cells that are harmful, do nothing. And that's where cancer is such a bugger. And this is why cancer research is trying to find out how we can detect this early. Because, the cancers are made by our own body, so they get through our defenses. And it's not until we start feeling bad or someone goes into screening and that we find that cancerous spot. So lung cancer is basically split up into 2 kinds, non-small cell lung cancer and small cell. Non-small cell, it grows a little slower. It can still be aggressive when it hits its endpoint, but it is slower. And unfortunately, it can affect non-smokers and smokers. On the flip side, you have small cell lung cancer. This one is a very aggressive type of lung cancer, and it's more associated with patients who do have a history of smoking. So let's talk about the importance of where the screening starts and why we push it so much. With any kind of screening, kind of like your colonoscopies for colon cancer, your mammograms for breast cancer, early detection is key. If we could prevent cancer, that would be absolutely amazing. But right now, we can't predict it. So we initiate these screening programs so that we can catch it early. And just like any other cancers, lung cancer is staged 1 through 4. And this all depends, one, on size and has the cancer spread outside of the lungs. Here at Parkland, stages, we go for complete cure or remission. Of course, the lower the stage, 1 and 2, the easier it is to treat for complete cure. We go for cure between stages 1 and 3. 4, we go for remission. So at Parkland, we treat everyone and we go as hard and we are in the battle as much as those patients want us to be. So it's definitely a joint decision. But again, early detection is key. So how do we do lung cancer screening? So it's done with a CT scan, and I like to call it the donut because I know I have patients who are claustrophobic, such as myself, and an MRI, which is the long, skinny straw, does not sit well with me. But the CT scan's a big, open donut as a whole, as you can see here in the picture, and it's done with a low dose of radiation. And in screening, we encourage it once a year, again, just like all the other screening measures like mammograms. And so what this does, it takes a picture of your lungs and it looks for, anything that's suspicious, spots in the lungs, which we call nodules, masses if we find them. And depending upon what we find is what triggers the next step. So currently, there is a criteria that's set out, and it's gone nationwide. What is the criteria for a patient to undergo lung cancer screening? We start between the ages of 50 to 77. Some insurances will cover up to 80. Medicare and the Parkland Financial Assistance Plan covers up to 77. And it's for patients who are currently smoking cigarettes or who have quit within the last 15 years. They have to at least smoked a 20 pack years. And basically that's an equation that we use to kind of calculate. But I tell people, don't get hung up on the equation. If you're not sure, did I smoke enough? Do I not? Has it been long enough? Just come to us. Just come to us. Let us do the work for you. Let us do the math and let us help you. And typically these are patients who don't have any symptoms because it's a screening scan. If you come to me and you say, Glennis, I have symptoms, then I'm going to do what we call a diagnostic scan, where I'm going to look for something. And it just takes a little bit more detailed pictures than the low dose scan. And again, we do it like once a year, once every 12 months. And those are the things that can get patients into our lung cancer screening program. That is briefly the equation that we use. Don't worry about it. Don't let it hinder you. Just come to us. Let us do that math for you. And again, this is what the donut of the CT scan. For those of you who don't like needles, no worries. This is needleless. You don't need anything in your arm, and it's a zip in, zip out. It's probably 10, 15 minutes. No lie, the wait time might be longer than the scan itself. So we try to make it as easy and seamless as possible. And so these are just some pictures. I know this might be a little much, but if you see down there, this is what a picture of a nodule look like. This is what I look for. So if you see these are 3 different CT scans. The black is air, so that's where lung. The white thing in the middle is your heart. But if you see right here, this little dot here, that is a nodule. There, you can see it's pretty round, and there's another one there, and another one here on the other side of the lung. So those are the things that we look for. And again, depending upon the size and location determines what we do next. Not all spots in the lungs are cancerous. Some of them can be scars from like repeated pneumonia. Have I seen some patients who've had COVID have some of these nodules? I sure have. They can be scars from patients who used to work in occupations that were exposed to chemicals and dust and things like that, or they can be seen in former smokers. So once we find them, we monitor how they behave. And then we get you plugged into the program where we just watch it to make sure they don't grow or you don't get any new ones. And those, we just really keep a close eye on it. So what happens next once you get the CT scan? Well, you get plugged into our program. You might get a phone call from me. We go over the results. And then as a joint decision between you and I, we then decide, what do we want to do next? Do you want to stay enrolled in our program? Or based on the results, I'm like, hey, I think I need to get you in my other clinic, what we call our lung diagnostic clinic, who does more workup on the nodule to determine, is it a scar? Is it cancerous? Whatnot. If ever you kind of worry, well, I don't meet the criteria, but I am a little worried. Well, then we try to, get you into our Parkland system to get you in with our primary care clinics so that you can talk to a provider, or if you've got a provider within your Medicare network, talk to them. But definitely talk to someone to ease your worries because, peace of mind is priceless. So our big thing is, we encourage everyone to stop smoking. And we have a smoking cessation program here at Parkland Hospitals. What are the benefits to quitting? It helps with blood pressure. It helps with cholesterol. It helps with cholesterol leads to the clogging of your arteries. So it helps prevent any further blockages. It helps with your breathing, because what happens is that the contents in cigarette smoke, they don't allow the oxygen to attach to your red blood cells, which is the transporter of the oxygen throughout your body. So if you're only really attaching like maybe 60%, then you're not getting the full benefit of it. And that's where a lot of patients may have the shortness of breath or the wheezing. But after you quit, that circulation improves. We have little hairs in our lungs that help clean up all the stuff we've breathed in, whether it be pollen or dust. So those start to wake up, and some of my patients will be like, oh my God, I'm coughing so much stuff since I quit smoking. And it's because you're waking up your lungs and they're trying to clean house. And then you'll notice you're breathing a lot better. And so I know some patients have say they've been smoking for years. It's a hard habit to break, but we're here to help you. Is it impossible? No. But as long as you always have a day one and you're mentally ready for it, you've given it up, you've lifted it up, you're not owning it, and you're ready, let us help you. And we can get you plugged into that program. Yeah, these are just some little tidbits that you can help yourself quit. Like I said, as long as you always have a day one, that's what's important. Pick a goal date, a quit date, or do baby steps. Give yourself a date. I'm going to cut down by 1, 2. It's all about baby steps. If you give yourself this huge goal, unfortunately, if it's too hard to attain, I don't want anyone ever to be discouraged. So I like to celebrate the small victories. I even tell patients, it was a suggestion from another patient, they put their cigarettes in the freezer. That way, if they ever wanted to smoke it, they had to wait for the cigarette to defrost. And by then, the temptation, the itch went away. Distracting yourself, having a great support system, whether it be online, like in this wonderful community here, or your neighbors, someone to help distract you when you get that itch, go on a walk with someone, engage in some fellowship, anything to help distract you, or even a family member that you can help them, find ways to avoid the trigger. What are some things that Parkland has for? We have, again, a tobacco cessation program. There's some Texas, the Yes Quit hotline. And don't worry about trying to take a picture of the slide or trying to write down all this information. We're going to be able to give y'all a copy of our PowerPoint and all this, that y'all have access to that as well. We also provide those who can't, we help with nicotine patches, gum, lozenges. There's even those who are willing to try the Chantix or other medications to help quit smoking. And then this is, I think it's like a testing kit. Yeah. Test kit to test for any radon or radiation concerns in the home. And that's it. Sorry, I know it's a lot of information in a real quick time, but does anyone have any questions that neither Natalie or I can help y'all with in regards to our program? Natalie, is there anything that I may have forgotten that you might want to chime in on?
First of all, you did it perfectly paced. So thank you so much. I know that you felt like it was fast, but I do feel like every piece got its moment. So thank you, because it just exemplifies your great work with our patients and how we're dedicated and we're really there to kind of take them along that path, whatever that path looks like. The only thing I do want to add on is when the last thing that popped up about Texas Tech for radon, there is an odorless gas that is radioactive that has been shown in place for people that are in basements or that work like in mines or that have a history of a specific area having a high amount of that gas. That has been linked to possibly increased cancer. And so we can get free testing through the Texas, I want to say it's Texas Tech that runs it, but it's called Texas Radon, and they'll offer free test kits for you. If you go to our Dallas Health and Human Services site, they link you straight to that as well. And so it's less common here in Texas. It is a little bit more common up north, but it's a good one to have. So I think that's the only little slice of extra information that we could share.
I do have a question. What age typically are you able to detect lung cancer? Are you seeing children? Are children able to get lung cancer?
So I haven't seen any in children. Being at Parkland, we see those, but our youngest one, I mean, they're not children. I think my youngest patient's probably 35. Okay. With lung cancer. There's other things called thymomas or thymic cancer, which is in the chest, which can mimic those same types of symptoms. We did have an 18-year-old that did transition from children's to us. So those are more associated with children and can get worked
Mhm.
up in a children's hospital. Mhm.
Obviously, you talked about ways we can avoid or make it even more difficult um, to get lung cancer. Is it hereditary or?
Yeah. Well, like I said, so we unfortunately can't test for lung cancer like you can for breast. But if I have a patient who even says to me, like, Glennis, I quit 10 years ago. My mother was a smoker. She got lung cancer. My grandmother, because back then smoking, we didn't know what the dangers were. I mean, doctors were smoking as they were walking down the halls in the hospital. But if someone tells me they have a significant family history, like even up to two family members, it'll get my interest. And then I'll be like, you know what? Let's get a scan on you. And so I will do more testing on patients who have higher risk factors than those who is a non-smoker but exposed to secondhand smoke. So like each case and each person is different.
Mm,
But when they do have that significant family history, even if it's not lung cancer, if they're like pancreatic, the colon and lung, and then I'm like, okay, I wish there was a way, but we just haven't found it yet. But it will make me pay more attention to that patient because of that history.
absolutely, absolutely. Ladies and gentlemen, put your questions in the comments section there if you have any. Um, where are you seeing the greatest number, if you will, as it pertains to Dallas? Is there a certain zip code area of Dallas that you're seeing more cases in?
I think Natalie's got that information.
Okay.
So,
Yeah.
it's a great question, and I'm trying to think if we have an updated version. There are certain areas where we will kind of focus education in, and so there are, and it's not going to be necessarily surprising. Kind of like southeast Dallas is kind of the area where we really want to get education out. One of the things that we have noticed for those patients that have the risk factors that would lead us to screening, so that are between 50 to 80 or 50 to 77 here at Parkland, or that have that pack your history. So they've told me, or they've told their doctors they've smoked about maybe one pack for 20 years would be a good factor of that. There is a group, and it's thankfully a small group, which is good, but then we want to make sure we find that small group, right?
Yeah.
And so it has been found to be English speaking African American persons. And so that's one of the things where when I go out in the community or when I'm talking to someone, I want to make sure that we give all of the education and all of the power to the people that are in our communities to get the word out, because it might not be you, but it might be someone you care about.
Right.
Mm-hmm.
Right.
Yeah.
Yeah. That's great. That's great. Obviously, we're seeing the cartridges versus cigarettes now.
Yeah.
Is there a significant difference between the two when it comes to lung cancer? Is there an increased risk, or is it decreased, or is there any difference?
So I was actually just looking this up, so I wanted to get it right. So with cigarettes, because it's been around and we've studied it again, of course, it's got more chemicals that have been linked to lung cancer. The cartridges, because we don't necessarily know, they probably do have a lower risk of lung cancer, but they might have a higher risk of lung injury because in those cartridges, remember for like the good first 2 years, no one was like the FDA and the tobacco, was that alcohol and tobacco? No one would claim it. They're like, it's not a food, but it's not tobacco. So no one was regulating it for the longest time. And there's a preservative in there. And I've heard anything from olive oil to formaldehyde. So it's like it's a higher risk of lung injury, but a lower risk of lung cancer. But I feel like it's hard because you can't quantify it, right?
Right.
I have a
Right.
patient who's like, "Hey, Clarence, I quit smoking, but I'm doing these cartridges," and I was like, "So how long is a cartridge lasting you?" Well, it depends. So I buy the extra large one or the large one, and sometimes I'll puff, or sometimes I'm like, depending on the day. So you can't really quantify it like you can a cigarette. I'm down to 5, I'm down to 3, I'm up to 6. I mean, I think one might be the lesser of two evils, you
Right.
know?
Right. Right. Someone just asked a question here. What is the most effective treatment for lung cancer?
So that a lot of it depends on the stage. So for example, you come into lung cancer screening, and I've got so many patients who are so grateful for their providers for lung cancer screening. They'll come in and they have one spot. One spot is a stage one. So it can either be surgery, but I know a lot of people don't want to be cut on. They're worried about their quality of life after surgery. They may not have the support to be able to recover well at home, but surgery is the first one that they do recommend for stage one if their lungs are strong enough to have surgery. If not, we've got the option of radiation. We have our radiation oncologists are partnered with us over at UT. And it's not like the microwave it used to be, where a lot of patients saw like the breast cancer patients having burnt skin and all that. It's now done with lasers, and they like really target in to where they don't do these long weeks and months of radiation. So that's an option. We have a new option, what we call cryotherapy, which is new to Parkland. Our radiologists have been trained by MD Anderson, and this is where they can go in and they freeze it from the inside of the actual spot. So you can either get it frozen from the inside out, fried from the outside in with lasers, or just completely removed. So we do our best to be able to provide all sorts of options for those who can't have either of those because they might be a farther stage, like maybe a 3 or 4. We have like an oral therapy nowadays. We do have the old fashioned chemo coupled with radiation. And we also have what they call immunotherapy. So I know a lot of patients are really scared of chemotherapy because of the stories. And they're not false. They're absolutely true. But we have oral therapy now. Patients can go on a pill. My longest patient for stage 4 lung cancer has been on the same pill for 5, 6 years now. She's amazing.
Wow.
Yeah. So we do have options. So I tell people don't let the treatment scare you. Come in, let us talk to you, let us screen you, because it's such a great program. We've got the funding, and we just really, really want to reach out and touch as many people as we can, them and their loved ones and friends.
Yeah.
We just really want to make an impact.
What you mentioned chemo and radiation. For those that may not know, what's the difference between chemo and radiation?
So chemotherapy is a medicine that does go through our veins, and it goes through our whole body. These are the patients who are maybe stage 3, stage 4, where it has spread outside the lung. So I tell them chemotherapy, it's hard at first because we're cleaning house. We are getting every cancer cell we can from the top of your head down to the bottom of your toes. We want to clean house. And then we just want to really bust it up. And it's hard, but then does it work? It does. But if I can help you through that battle, you and your family members, that right there is 3/4 of the battle. After that, radiation is like what I said, the lasers, where we go from the outside in. And a lot of times that is coupled with chemo, because if a patient and their families are like, Glennis, we want to beat cancer, give it to me, I'm here, I have my faith, I've got my family, let's do it. And we'll do radiation and chemo, and we will kick cancer out.
Yeah.
Again, we want to clean house. And so that's the difference. But patients who can qualify or do have a certain marker for the pill cleans house too. And you can take it at home, and you only have to see my happy face once a month. So we've got that option, and it's an amazing option too.
Wow. Great. Great.
Mhm.
Are there any other questions? Has lung cancer been tied to any other cancers? For instance, if I get lung cancer, does it spread into something else? Um, and I'm not even sure if I'm asking that right.
Yeah. So lung
But
cancer,
if I get one cancer, can I also develop other?
no. But you can most people want to know, where can lung cancer spread to? Because some patients, the way they explain it, they'll be like, well, my mom had lung cancer and then they got bone cancer. Well, it's more that lung cancer can
Right.
spread to the bone. So a lot of the other places that we've seen it is in the bone and in the brain. So so once a patient is diagnosed, I do check their brain, and that's the only time I have to stick them in the straw, which is the MRI. But it can spread to the bone and the brain. And those are the two most common areas.
Wow.
But to develop another cancer because you have lung cancer, it doesn't cross over like that.
Okay. Okay.
Mm-hmm.
Wonderful. Wonderful. Well, I'm not seeing any more questions come through. Any closing remarks? I think you've given us, great information, but I think the way we just closed it is that even though you may have cancer, there's still hope.
Oh,
There's still
absolutely.
options. It's not necessarily a death sentence.
No, 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 it isn't. And that's, I think that's why we feel so passionate about it, because I know a lot of people are scared of it, but I'm here as, you have a team of people on our clinic. And me, when I say I feel like this is my God-given gift, it's me to help balance the God's gift of modern medicine with faith. And I believe faith, if my patient doesn't have faith, if their spirit, their mind, their heart is not in it, I encourage them, because I do believe it's all linked. So I feel like that's my role here, is to educate, to help encourage, to help pray with them and their families, because the survival rate is increasing, and I don't want fear to hold anyone back. We're not meant to live in fear. This is our faith. This is what we live by. And this is why I believe I've been placed here. This is why we have modern medicine, but modern medicine doesn't replace faith. And I feel like that's our role here. And Parkland is here to reach out to that community. We're here, I don't want to say I'm begging you, but I'm like, hey, we have this program. We've got this funding. We have cancer societies who are like, yes, please reach these people. And so we're here to help get, transition. And Pastor Holiday, you and your community have been amazing. What your work here. And Natalie and I are just blessed to be here. We're just happy you invited us. So
I'm excited to see your passion. I wanted to ask you, do you want to come preach Sunday?
I've been tapping my toe. I've been trying so hard not to swivel. I saw your video, and your passion is that opening message. You find someone who loves like God. I was like, that's what I'm going to tell my kids. You love someone who loves like God, because I was like, you do amazing work. You really do.
Thank you so much. Thank you. Well, I really appreciate. I look forward to meeting you all in person. Soon. And if there's anything we can do, please feel free to let us know. When you can send me the slide to the email we've been exchanging in, and I will be more than happy to share the information. Jamel, you just commented. Yeah. Awesome. Thank you so much. Let me close in prayer, and we'll be done for tonight. Father, we thank you for doctors and nurses and aides and medicine that you've placed here to be able to help us make it through life. And we thank you for the hope we have. Thank you for the people you've placed, your children, in places and spaces like hospitals and nursing homes and clinics that are able to minister to us in moments of need and maybe perhaps doubt. Father, I pray, God, that we would take full advantage of everything you have given. You said all good and perfect gifts come from you, and we know that you cause all things to work together for our good. Father, I pray blessings upon our presenters, that you would just continue to walk with them, give them longevity, continue to increase their passion, and then fill them up every single day as they continuously pour themselves out to others, people they know and perhaps people they have no idea of who they're talking to. We thank you for their ministry. In Jesus' name, amen.
Amen.
All right. Thank you so much. And I will see you all later.
Good night.
Good night. Pivot, y'all have a good night. I'm so excited to see you all, and I will see you all on Sunday. God bless you. Be strong and courageous.